See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
Not all medical schools or nursing schools have a lot of training about the healthcare disparities that are particular to each community.
We provide people with the information that they need to really be empowered in their care, but we don't have that expectation that they need to come so prepared to tell us how to provide top-notch care.
FOLX HEALTH is a telehealth platform, and it is focused on the LGBTQ community to provide joyful and affirming and empowering care.
We have a digital or telehealth first model deliberately to provide greater access to people who are living all across the country.
We do that by meeting that person where they are and addressing their healthcare needs from a place of respect, affirmation, and making sure they feel cared for as an entire whole person.
This work that we tackle is all about access. We're constantly iterating, learning, changing, adapting, increasing our services to meet the demand.
The number of bills trying to get through state legislation, a little bit more than 500 right now that are affecting the LGBTQ community, and about 100 of those are actually impacting access to healthcare.
All people stand to gain from the work that we're doing in the LGBTQIA plus health space to elevate the bar of the standards of care.
Welcome to See You Now. I'm Shauna Butler. In our ever-evolving landscape of healthcare, access to quality care remains a significant challenge for everyone, but particularly for historically marginalized communities who have well-documented health disparities, outrageously costly health disparities, contributing an estimated hundreds of billions of dollars in excess medical costs annually. And the LGBTQ plus community experiences health disparities in a number of ways that are tied directly to access to care. The number of U.S. adults who identify as LGBTQ plus has more than doubled in the last 12 years, according to a recent Gallup poll. Over 20% of Gen Z adults identify as LGBTQ plus, and a high percentage of them say they have been treated unfairly or with disrespect by a healthcare provider or payer, leading many to delay or postpone care due to that disrespect and discrimination. Amid the tense and volatile backdrop of proposed and passed anti-LGBTQ plus legislation, the need for expert, accessible, affirming, respectful, and affordable care has never been more pressing. In this episode, we learn how two mission-driven healthcare experts are leveraging technology to break down barriers to access to care and constantly redesigning and rebuilding a respectful, scalable, transformed telehealth delivery platform and model centered on the needs, locations, and health disparities of the LGBTQ plus community, and in the process, improving and expanding access and exceptional care for all.
My name is Kate Steinle. My pronouns are she and her. I am a nurse practitioner and the Chief Clinical Officer at FOLX HEALTH. Prior to FOLX, I worked at Planned Parenthood in New York City and then in the greater New York area for 10 years. And I started out as a clinician there and then moved on to being the Director of Quality Management and then the Vice President of Clinical Services. And while I was there, started the Trans and Non-Binary Hormone Program. So, I've been dedicated to providing care for the LGBTQ plus community forever. That has been the driving force of how I've worked in terms of rolling out new services targeting the LGBTQ community. How do I make this more applicable and accessible? And so, when I thought about joining FOLX, I was like, yeah, that's it, because it's not just trying to fit this community into kind of like a side part of the model, it's really shifting it. FOLX Health is a telehealth platform, and it is focused on the LGBTQ community to provide joyful and affirming and empowering care. And we do that by addressing their healthcare needs from a place of respect, affirmation, making sure they feel cared for as an entire whole person. We offer primary care services, sexual reproductive health services, mental health services. We also have a community platform for people where they can connect with other members of FOLX. They can join a support group. They can have educational materials. We have this really exciting thing called Pride Camp. Every day there's an activity, and sometimes multiple activities, where they can go on building community with people across the entire country and coming to FOLX for making their lives and their health better.
My name is Teddy Tinnell. My pronouns are he, him. I'm the Director of Clinical Operations at FOLX Health, formerly the Director of Nursing. I'm a master's prepared registered nurse by trade turned techie, geeky operator. On a daily basis, my mission is really taking the skills of strategizing and creating dynamic solutions to craft exceptional care experiences for trans and gender nonconforming people. I've got a background as an LGBTQIA plus health educator. I've also worked on research teams related to queer and trans health initiatives, as well as volunteered over the past 3 or 4 years at several different queer and or trans youth camps throughout the United States. My work is much more than LGBTQIA plus health, but that is certainly a gravitational force to me. On a personal and professional level, it's very motivating, and I would love nothing more than to see the success of these communities and just abundance of access and exceptional care for all people.
Teddy, why don't I start with you? How important is a name and people wanting to address you with the name that is most meaningful to you?
Part of the foundation of affirming care definitely starts with how people want to be addressed. I think it's an extension of bodily autonomy, how you want to move about the world, how you want to be seen and recognized and validated. It's absolutely sort of a preliminary sign of respect. It's interesting in health systems, especially with my background in working some with larger health systems, some with more like techie kind of bespoke health systems. The timeline to change to add something as simple as a pronoun field in an EMR or to note affirming name can take years and years and such hard work and systemic effort. And then you have organizations like FOLX where we're able to kind of pivot and incorporate that so quickly. But yeah, I think affirming communication is essential to really any, especially patient or interpersonal interaction to get off on the right foot.
And so no matter who you are, you want people to see you as how you see yourself. What about you, Kate, from the standpoint of thinking about the importance of names and making sure that when somebody says your name, you feel loved and safe?
Yeah, at Planned Parenthood, which is where I was at for a really long time, we did a lot of trainings around how to make sure every spot that patients would encounter a clinical staff member, that they felt like that person saw them, they addressed them correctly. And it took a while to get the staff on board because they were like, well, if I ask these questions, won't people get offended? Or won't they think that I am assuming something about them by asking a question? What I told people was, it's okay that you might feel uncomfortable with these questions, but I promise you that it's going to make your patients comfortable. What is going to be that wonderful experience is that non-binary person who's never been asked a question and prefaced a question in a certain way and then finally is seen. And so creating those systems around making sure that the individuals who the system was not built for actually we're building the system for now is really what I worked on with that training. And it took people a while. And there was that discomfort on the staff. And then it got to the point where people understood, like, this is actually what is going to make that patient in front of me feel seen, feel heard. I'm addressing them with the correct name. I'm making sure that I'm using their pronouns and their partner's correct pronouns. And it drew people out. So that is really what we think about.
In thinking on that, it's a really good way to say congratulations, Kate. How exciting to be recognized by Rock Health as among the top 50 in digital health for 2023. Rock Health has been a leader in investing very specifically in digital delivery of healthcare. So one of the things that you were noted for was being an equity advocate and addressing health inequities and injustices. And they described you as a nurse practitioner who believes that the lived experience of the most marginalized in our community should always be the ultimate guide to how we provide care, and how healthcare can be a place of radical transformation and empowerment for both those who access the care and for those who are providing the care. Those are pretty bold statements, but what in your experiences, what in your practice has really helped you to make a confident, bold declaration and belief about healthcare being a radical place of not only transformation, but I want you to lean into the word empowerment. How does that work?
Yeah, I have seen over and over again in all of the clinical practices that I've done that when you actually engage as a partner with a patient and engage with them in discussions about their health, you treat them as experts in their own bodies. You have the studies that you've read, you have the training, but you don't know what their body is and how they've interacted with it and how they feel about it. And when you draw that out from them, there's this equality that happens between I'm not more right about something than that patient is, right? I will be a resource for them to understand, okay, so what you're describing to me, patient, sounds like this. Did I get that right? I'm going to put some medical terminology and medical background behind it, but I want to make sure I'm getting that right. And I think that brings us on that kind of path together where I'm not just kind of passing down information from above. You are along this with me and we're doing this together. And I think just that piece right there is where the transformation happens. And I see that again and again with conversations that I've had with patients over the decade plus time that I've been providing care. Not all medical schools or nursing schools have a lot of training about the healthcare disparities that are particular to each community. And if you're fitting everyone into this cookie cutter mold, what that standard mold is not going to apply to people who are historically marginalized, like the LGBTQ population, or people of color, or poor people, or people who don't have access. Maybe they live in rural communities. And so if your training or your experience on the job has not helped you as a clinician to know how to engage with that and to elicit that information, and really, again, to be the expert you are, even though you're a partner, you're supposed to be the expert on what those healthcare disparities are and how to address them. When I think about what clinical practice should be for everyone, and especially should be for people who have been historically marginalized and been on the outskirts of how healthcare addresses their needs, we need to do better. And that is what it is making and leading them along this journey to understand your power is in your body. And I'm just going to help you understand what that means.
Both of you have been real pioneers in talking with people about highly sensitive topics. What have you learned from those experiences that have brought you to a place that says, wow, there are communities of people and types of care that don't receive the same level of authority, respect, protection that other parts of care, just without any question, are protected and respected.
When we think about in the world, like sensitivity around certain topics, for sure, that's there. And the purpose of this is to make it so that you can feel like your body is something to be talked about in a way that you feel most comfortable and affirmed. And I think that's the piece is like, I talk about bodies all the time, and probably my friends and my family are like, you maybe overshare about things all the time. But I'm like, that's how we get to the place where it's really, this is our body. And if we can't talk about it, then we're not going to be healthy, right? Because then we're hiding things from either our providers or our partners or ourselves. And so I think you take some of that like shadow, scary stuff away, and also recognizing that everyone comes at that at a different pace and not push somebody, but just as continuously recognize like the purpose of this. Teddy, I want to hear from you actually. So
Yeah,
please.
well, a couple of things come up for me. First, Kate, I think that ability for clinicians to be adaptable and meet the patient where they're at cannot be underestimated. I think it comes from this place of knowledge and expertise, but also open-mindedness. Um, in my work prior to FOLX Health, I was a LGBTQIA plus health educator at a large safety net hospital system. I've also worked on a couple of different research teams related to queer and trans health initiatives. And in one common thread between that work was patients were looking for providers who care. It is so difficult in a training. There's not a one size fits all sentence or way you can ask something, way you can say something. There's a dynamic element to interpersonal interactions where you have to be flexible. It's more about your ability to adapt and to respect people than to say the right thing. Um, but really, throughout many different areas of this work, what comes out is that people are looking for that empathetic, compassionate care. One other thing that I was going to add earlier, Kate, is as you were talking, is I think for trans and gender nonconforming people, historically, these are communities that have had to be so self-informed about the care that they're seeking. This is certainly true for myself. And part of the reason I gravitated towards this work was my own personal experience of trying to access gender affirming care a decade or so ago. And that really set a path into motion for me. But at that time, and certainly earlier, and it's still true today, it felt almost as though to access gender affirming care, you had to do so much research that you were like well on your way to getting a medical degree anyway. So what happens now especially at a place like FOLX, or when you have healthcare providers who are informed, there opens up this beautiful dynamic between the provider and the patient where you can really take the patient's lead, but the provider can also step in with that expertise that they have and really take some of the weight off. I think it's this dynamic where some people do want to come in and say, this is the dose I think I want. This is the route I think I want. But sometimes as a trans person, there is something unfortunately, that feels almost like a luxury these days when your provider actually is informed and can facilitate that space and that plan of care for you. For me, this work that we tackle is all about access. And I think all people stand to gain from the work that we're doing in the LGBTQIA plus health space to really elevate the bar of the standards of care. But the work has to happen on every single level, from community clinics to large hospital systems. It's such a collaborative effort. And it comes down to, the smaller things like pronouns and affirming names, to training at medical institutions, all the way up to policy and advocacy and sort of addressing the current state of affairs in the United States and that impact on the well-being of LGBTQIA plus people.
You mentioned the United States. I would say actually around the world. I mean,
There.
this is a global health issue. So I'd love to hear more, starting with the name and what was the unmet need that drove the design and the creation of FOLX Health?
So FOLX Health started in 2020. Our founder was A.G. Breitenstein. And really it was started off with I would call it a simple goal, which I put in quotes, of creating an entirely new model of healthcare where the LGBTQ plus community was the center, right? We were the default. So the system was built around the needs of that community, bring in clinicians who are expert on this, but also how to make sure that this was engaging to people so that it really did create this joyful and empowering healthcare experience. And I think, when you first see that, you're like, healthcare that's joyful and empowering, joyful because you feel different. You feel different when somebody is an expert in your particular healthcare disparities and addressing you as an expert in your body and really drawing you into that partnership. And you feel empowered when you walk out of that visit because you're like, I got so much information. That person listened to me. And I'm really clear on the next steps I'm taking because the education was directly addressing what I came in for. Joyful and empowering comes from how we provide the healthcare and how we engage in that way. So FOLX Health, and FOLX is spelled FOLX. The name came to be to encapsulate an entire community, all of the folks. And you're really talking about a group of people, the LGBTQ community. And when I say that, I'm talking about understanding those healthcare disparities in every single thing that we do. So understanding that there's a higher prevalence of mental health conditions, of depression and anxiety in this community. And how do we make sure that we are addressing that in every visit? Understanding that there are higher rates of obesity or eating disorders in this community. There's higher rates of heart disease. How do we address that? There's higher rates of cervical or chest breast cancers because people are not taking the steps or don't feel comfortable taking the steps to address some of those early screenings. Again, because they're uncomfortable going into certain practices. Higher rates of substance abuse and use and higher rates of tobacco addiction. When we understand that as a clinical care practice, we then know how to ask the questions. That's what we're talking about. In the regular or outside of FOLX Health medical model, the standard is cisgender, heterosexual, and financially stable population, which the medical model is built on in a lot of settings. And then to switch it where your center is this community and those healthcare needs, that is what we do.
That's a big vision that you need to execute. And so I think it makes a whole lot of sense to talk with the clinical operations on the operations side, Teddy. So how are you actually delivering care? I mean, FOLX as a digital health, wellness, and a platform, it's so much more than virtual care.
We have a totally holistic model of healthcare. Though we are centralized around LGBTQIA plus community, we also understand that the members that we work with are people. So we take a look at primary care services. We meet you where you're at for a number of different concerns that you have, potentially unrelated to being someone who identifies as LGBTQIA plus. So we have our healthcare arm. We have a community platform that is a wonderful space for people to connect and share. We have a library, which is a fantastic resource for people to self-serve and stay informed. We provide people with the information that they need to really be empowered in their care, but we don't have that expectation that they need to come so prepared to tell us how to provide top-notch care. But we do make that available and accessible for free for all people who are curious. In the clinical operations space, for me, that is so fun and uniquely challenging about this work is that we practice across all 50 states, and there are such different regulations in telehealth in general for practicing, but especially for trans and gender nonconforming care. So it creates this ever-changing and dynamic landscape to sort of work in. One of my favorite things about working in clinical operations is getting into this flow state with all of our colleagues at FOLX to solve for these challenges that come up on a daily basis and work hard and continue to push to ensure that we are providing access and increasing our access to LGBTQIA plus people everywhere. At FOLX, we have a digital or telehealth first model deliberately to provide greater access to people who are living all across the country and hopefully eventually the globe. My wish for trans and gender nonconforming people specifically is abundance. We're constantly iterating. We have great dialogue with the communities that we serve, and we're constantly learning, changing, adapting, increasing our services to meet the demand. And some of the most moving patient experiences that I've witnessed really come from people who are quite remote, who don't have any affirming access to care whatsoever in the small cities or towns where they're located. And to have the option to access a world-class provider from the comfort of your home and know that you'll be treated well, get medications delivered to your door is an incredibly safe experience for people to have. Something that's great about the way that we leverage technology is we take technological tools to free up time for our clinicians to provide really good quality care. So we're using technology to automate the things that we don't want our clinical team to have to waste time on, specifically so that they can get more face-to-face with our members.
And over the past couple of years, we've also expanded into the larger primary care service offerings. And what that looks like is providing both ongoing or chronic care management of diabetes or hypertension or perimenopause, menopause, fertility issues, or even episodic concerns, right? So somebody comes in for a dermatology issue or UTI concerns, or maybe they just need STI treatment or STI testing. We expanded into that because our members were coming to us over the years saying, we love you for gender-affirming hormone care. Can you also be my primary care provider? And so making sure that we can offer all of those services and really being that home for people. I often talk to people about how telehealth as a primary care provider actually works really well because we are the hub of all of the things that that person might need from an education, obviously a treatment, ongoing management perspective, and we help refer them when they need to go in person. And that's where it kind of goes into this whole person aspect. We actually use a lot of the technology tools to make sure that we are doing that in a really efficient way. We have this whole care team that surrounds the clinician. So what happens on that clinical visit is there's going to be the assessment, the diagnosis, the treatment plan. And then after that, just like Teddy said, to remove the clinician from having to go and search for where to send that patient to, that's where we tag in the rest of the teams and all of the systems that we built around that. So that a referral is not going to be sourced by the clinician. It's going to be flagged for the other teams to make sure to go into our referral database that has been vetted for gender-affirming providers, for anyone who is LGBTQAI plus affirming, that is in person, and create that connection and that relationship. So again, using all of the ways that our teams communicate through our technology platform to link that patient with what they need, get them there, get the information back to the clinician to make that assessment and that ongoing care plan. It's very different than when you're in an in-person clinic, or especially in a community center, where the end of your day as a clinician is doing all of that work for all of the patients that you saw that day. Okay, now I have my list of things where I've got to go figure out how to get them the care they need. When you have a platform like FOLX Health, where we are all interconnected with the other teams, it relieves that responsibility from the clinician because they know it's being cared for by all of the pieces that we have in play from a technology perspective. So I think that's how we scale this and create this really incredible experience for that member, where they not only have that kind of hand-holding, but they also have a lot of communication around where they are in that process. And we are also communicating with them about when their labs are due, when their next refill is coming up, what's going on at the pharmacy. And in a lot of other clinical practices, they're kind of trying to solve for those things themselves, or really just out there on their own. And the fact that the telehealth platform that we've created is really that wraparound service allows them to not just feel that, but really experience that continuity.
It really is providing good holistic care for all people. This community holds us to a very high standard. And so they have high demands for us, and they definitely let us know what their needs are. So depending on the state where you live and what your needs are, your patient or member journey might look very different. Our website is the place where most people start, and there's a lot of educational resources that they can find there, and a lot of information just about kind of our ethos and our mission. We now accept a number of different insurances, and we're working every day to increase our access to insured members. That has been some of the biggest success for us in the last year. They have the choice to select a provider who is based in the state where they live, and sort of read a profile and connect with someone who they feel would be a really good fit for them. Because we're telehealth, our clinicians work at various hours that often we've kind of tailored to meet the demands of people in various regions, as well as to accommodate the hours of the healthcare provider themselves. Different states have different requirements of trans and gender nonconforming people who are seeking care. So depending on the place that someone lives, Florida is a good example. There may be additional components and requirements, and we have supportive teams that will really work one-on-one with someone to ensure that they have the support that they need while working to meet those requirements. It's not easy for a layperson to necessarily interpret some of the complexities of these telehealth laws, but also some of the anti-trans laws that exist today. So our teams have spent a lot of time, and that's certainly been one of my biggest learning curves, but most exciting learning curves in this work, to really come to understand the nuance of each state's legislation in a very detailed way. So that's something that we bake it into our standard operating procedures, we bake it into our protocols, but we can really offer that facilitation for community members who are just maybe totally bombarded, or just in general a little bit lost with the current legal landscape. We do have language interpretation services available for those who need it. Kate mentioned earlier, we can also facilitate referrals to local affirming providers. And we actually have in our member operations team staff who does very detailed research, including calling and speaking to local providers to make sure that we feel like they would be a good fit for our member base before we would refer that member to their services. And then once they get to the point of actually attending the visit, it's sort of off to the races. The clinical team really takes the ball and gets things rolling, creates a safe and affirming environment, and really facilitates great delivery of care. Very true to form for LGBTQIA plus health, we are building ourselves because the tools don't necessarily exist for us. So we have in-house teams that work on all sorts of integrations with our EMR and also our pharmacy partners. So we are constantly building. We also have very close relationships with our lab partners. Part of our work in making those sorts of collaborations is also ensuring that our partners treat our members respectfully. So providing training, really looking into any sorts of incidents that happen. So our work is vast. It has a lot of touch points and a lot of moving parts, but it keeps it interesting.
I'd also like to just point out one of the things that Teddy mentioned, the state legislations that we've had to manage through. And in Florida last year, there was a law that was passed called Senate Bill 254 that required us to literally scrap how we provided care for gender affirming hormones in Florida and do it totally different. And then do it different again. And because it kept on shifting, there were so many week after week adaptations that we had to do. And having someone like Teddy and the dedication that he and his team had around making sure not only was it clear to everyone internally on all the teams what was required at what point, but making it clear to every single member in terms of all the communications that we sent out, what we put on our website, how we communicated through Instagram, how we communicated everywhere to say, if you live in this state, here's what we are doing for you, and here's what we need you to do. Yeah. And that was, I think about how much that did to calm the nerves of our internal staff, because we had somebody like Teddy watching all of that and adapting constantly and writing it out for us. That wraparound care for a member is somebody who's in that state being like, I don't know if I'm going to be able to get my medications, which are life-saving for me. And if I can't get them, I'm lost, right? And I don't know what to do. To have the communication so clearly outlined and updated when they need to just was like, if the law turns out that way, we will hold you and we will make sure you're okay. Yeah. And we'll get you what you need.
I want you to speak through the lens of health equity. There's just massive amounts of data and evidence that talk about health disparities, health inequities. And a really important way that we address them is having a workforce that is representative, that comes from communities where we live, how we play, how we love, all of those different dimensions of representation. You have been remarkable in getting a workforce that's representative, and you're thinking very much about access being an important element of equity. Let's leave aside for the moment the changing legislative landscape, but just for a moment, just pause and talk about health equity and how you're achieving that through representation and access.
In my career, I've worked in different environments. I sort of oscillate back and forth between the larger healthcare systems and a little bit more of the bespoke teams that are a little bit more LGBTQIA plus representative. The work has to happen in both places. But I will say, in working in the larger healthcare systems, I've often been in rooms where decisions are being made about trans and gender nonconforming people's health by people who really don't relate or have experience with those communities. And when you look at the types of solutions that come from a room that is guided and filled with people who have those identities represented, the quality is much different and much more representative of those communities. I don't think you have to be a part of these communities to provide expert level care for LGBTQIA plus people. One of my former colleagues at Denver Health said it best: if you're a clinician and you can manage diabetes, you can manage gender-affirming hormone therapy. This should be a universal skill that lives in primary care, but it really does make a difference when these movements are led by the communities that they serve. As my career has evolved, I absolutely still care so much about the experience of LGBTQIA plus patients. And I've come to care more and more about the experience of LGBTQIA plus healthcare workers and the different ways that workplaces can uplift staff and decrease burnout, especially for nurses. I think you'll find oftentimes nurse champions of this type of work are people within community who have taken it upon themselves to train their unit, and build trainings from the ground up just because they care about this work. They see patients being harmed, but they're also incurring some harm themselves.
Study after study has shown that having concordance, meaning the identity of the patient and the clinician are shared in some way, and sometimes many intersecting identities are shared, can lead to better health outcomes because patients feel kind of an automatic trust, and that gets you to that level of that partnership faster. One of the ways that I think about it from clinicians and clinician recruiting is if we almost flip it, that I don't actually think that just having the identity of being in the LGBTQ community makes you an expert in this care. In fact, what I actually want to see is what have you done to dedicate your professional career to providing healthcare for this community and focused on this community. That is more important to me than just being a member of the community, because that shows me that you have engaged in that way, that you have the experience about how to talk and how to address these healthcare disparities, and that you are dedicated to making sure that everyone in this community, that their lives are better and better and better and healthier. So I think that's just always a little twist on that I want to make sure to call out. It's not just a checkbox. It's about what you've done.
So let's switch to the legislative landscape. It is rapidly changing, not only across the country, but across the world. And there's just a growing number with an intent of removing rights, very specifically focused on the healthcare that is available to this community. So why don't you provide some color on what the legislative landscape is and very specifically how it impacts your team, your members, and then how do you run a company in this legislative uncertainty?
The number of bills trying to get through state legislation, a little bit more than 500 right now that are affecting the LGBTQ community, and about 100 of those are actually impacting access to healthcare. And so that is very impactful to all of the pieces of this business. This is the members. They are watching state by state in the places where they live that they and their identity and their ability to access healthcare is being focused on and talked about in public, in political settings all the time. And it's not being talked about in a positive way. It's talked about in how can we make sure that this person, this individual, does not get what they need to move forward in their life, to create a healthy life. As I said before, the percentage of mental health issues, depression and anxiety in this community was already higher. And now add on top of it that feeling of minority stress and that feeling of being attacked because of your identity or because of your sexuality, just adds and adds and adds to that. So that feeling of anxiety is extremely high for our members and extremely high in certain states, particularly the ones where the bills have been passed. So we think about it from multiple different levels. Yes, we are a healthcare organization. We take care of people. And by taking care of people, that is also looking at the laws that are affecting them. So we are on an ATA Action Committee, which is a lobbying group of about 20 different companies that really focus on how do we watch legislation and how do we make sure that we are addressing anything that we think is going in the wrong direction as a group. And so bringing that power together. We also monitor these. So our general counsel is looking every single day to see what particular state laws might be moving in the direction that might cause limited access for our members. And then once or if we think that something is passing, communication and addressing it and pivoting the services. So it's all of those pieces. It's the advocacy, it's the watching to see, and it is the communication and pivot our models. And from the perspective of a business, this is not easy. When you are at the whim of like waiting for what the DEA is going to say about the end of the telehealth flexibilities for public health emergency and whether or not we will continue to be able to prescribe controlled substances through telehealth, testosterone being a controlled substance, we have to plan for it in multiple different ways. And we are just wondering and waiting, and we have to make sure that we can pivot really quickly. So we have a lot of work and a lot of people looking at this all the time. And then when we have something, guess what's happening in Texas? All hands on deck. Guess what's happening in Ohio? All hands on deck. And how do we take care of our team? Because this is exhausting. It's exhausting because it's a lot of work, but it's also exhausting because these are shared identities, right? This is a group of people on our teams that's working around things that are directly affecting their lives as well as our members. And so, we have to both kind of put that in perspective. Also know, like, when we have to push because we have tens of thousands of people waiting on us to do this. And then after we get through that, what can we do to take care of the team too in that? So I think those are all of the pieces that we're constantly managing. And I have to tell you, it's nonstop.
We're talking about clinician well-being. There's also people who are transforming care, and it's hard work. When you're leading a movement, changing legislation that has created structural barriers. How are you guys taking care of yourselves, and how do you take care of each other just on a really very specific personal level? Is it yoga? Is it chocolate? Is it, talking with friends? What is that?
So I do get a lot of life from the conversations that we have on a regular basis. Personally, I'm very into my garden these days, despite the hot summer heat in Denver. But one thing I was going to say too is that I actually think, in spite of the difficulty of this work, it's almost in that difficulty that there's just so much hope and so much camaraderie. I love the flow state that we can get in together as a company when we're doing this work. And it actually feels really life-giving to make an impact. I always hope that people out there see the work that we do at FOLX and see that in spite of all of these laws, we continue to actually increase access. We don't back down. We work really hard, and there's people behind the scenes who are a part of these communities who are ensuring that we continue to move the dial forward and just build on the legacy of people, especially trans women of color, who have come before us in this movement. One thing in my work, especially with trans youth who are just incredibly expansive and also very humbling to work with. They call me a grandpa in my mid-30s. It's fine. But one thing I always hope that young people really see is that this is a community that is rooted in mutual aid, skill sharing. We have a history of creating access where no access was there to be found. We've made it happen time and time again historically. So I hope that people keep their heads up, they stick with the movement, they keep looking to their comrades and just see that there's people in this work who are not going to back down. And we're committed to continuing this mission.
We understand the magnitude of what we do and how it impacts people. And I think understanding that there are times where, like, you get off of a hard meeting or halfway through a day and you're like, wow, we solved that world problem. And it really depleted us. Like, that was really hard. All right. You go, I've got you covered. What do you need from me right now? And I think that's the piece where I feel very much taken care of by the group here.
I want to acknowledge you said we're on a call and we get off and realize we've solved a world problem, that's not an overstatement. You are truly solving world problems. What are you really proud of over the last year that FOLX Health has accomplished?
There's so much to be proud of what we have accomplished at FOLX Health over the past year. I think about some of the main ones being our work with enterprise partners, where employers now have and take on FOLX as a benefit for their employees, so that the employer is showing how much they care about taking care of this community. And so that's a huge one. We've grown those numbers of employers, which allows access for more and more people. We've mentioned before how many insurance companies that we are now in network for, which now makes that cost of a visit just a copay. We launched with Blue Cross Blue Shield of Massachusetts, which is an insurance company that does value-based care, where they're not only taking the cost of the membership and covering that for their members, because they understand the value of the entire membership in the community platform and what they can get there. But over the course of the years, we will be able to show in all the statistics and the research that we're doing for clinical outcomes of what this care model is doing for and impacting the health of their members. And so those are the kind of things that we're continuing to build with a lot of insurance companies. We launched primary care across the whole country and trained all of our clinicians on that over hours and hours and hours of training. And we've launched mental health services, individual therapy right now in 5 states, and expanding that across the country as well. So that's a huge one where people can now access therapy with really incredible therapists all through our same care model. It's been a pretty exceptional experience these past 4 years, a wild ride, and one that I am extremely grateful to be a part of.
Nurse practitioner and health equity advocate Kate Steinle is the Chief Clinical Officer for FOLX Health, where she continues her long-standing dedication to providing care for the LGBTQ+ community by asking, how do I make this more applicable, more accessible, more expert, and more joyful and respectful? Nurse and health educator Teddy Tinnell is the Director of Clinical Operations and the prior Director of Nursing at FOLX Health, where he puts his nursing superpowers to work translating, communicating, and operationalizing the nuances of legislation impacting telehealth care delivery to the LGBTQIA+ community across all 50 U.S. states, and eventually, he plans, across the world. Access to care is key to good health and good lives. And as Kate emphasizes, that care should be joyful and empowering. Joyful because you feel different when somebody is an expert in your particular healthcare disparity and in addressing you as an expert in your body and really drawing you into that care partnership. But for many people and for a variety of care needs, we are seeing reduced access to care, limitations, and bans to receiving certain types of care. It wreaks havoc, stress, and exhaustion for those seeking care, those providing care, and those daring enough to transform care delivery. Nurses are iconically known as care providers, but perhaps their greatest superpower is advocacy. As Kate says, yes, we are a healthcare organization. We take care of people, and by taking care of people, that also includes looking at the laws that are affecting them and the care we can provide. Constraints, threats, and crises are often catalysts for removing barriers and creating solutions to complex problems, particularly when our safety, health, and well-being are at risk. This is a great opportunity to learn from and lean into the lessons and legacy of the LGBTQIA+ community, who, as Teddy reminds us, is rooted in mutual aid, skill sharing, and who have a history of creating and increasing access to care where there once was no access. For See You Now, I'm Shauna Butler. Thanks for listening.
Nurses are transforming healthcare through innovation, compassion, and leadership. And Johnson & Johnson is proud to continue its 125-year commitment to champion nurses through recognition, skill building, leadership development, and more. The American Nurses Association is dedicated to building a culture of innovation. Nurses improve the lives of patients and communities through innovative thinking, empathetic connection, scientific rigor, and sheer determination. ANA is proud to support and advocate for our nation's most valuable healthcare resource, our nurses. For more information on See You Now and to listen to any of the earlier episodes in our library, visit seeyounowpodcast.com.